Okay. Hi, everyone. We are connecting for our event. I don't know, it's different times in different time zones. So we are giving a little bit more time so people can connect. I don't know if the sound is clear, if you're listening me clear, I hope. Yes? Okay, thank you so much for the feedback, and very welcome to everyone. My name is Gonçalo Leal. I'm a speech and language pathologist and a clinical director of the Stutter Center. And the major goal of our center is to provide online treatment and also training, mostly to the Middle East. So it's a great pleasure to be here today to discuss a topic that we love. It's simple as that. And the major idea for this event was to, I'm very lucky because I have these wonderful colleagues that I can talk with them, share with them, discuss the latest research in the field. And so the idea was to bring this, and now we have this opportunity to in a very easy way, go online and interact with each other. So the idea was to bring all this experience to online and to other colleagues who want to know more about these topics. So I have the biggest pleasure to have Farah here with me. Hi, Farah, how are you?
Hi, Gonçalo. The pleasure is all mine. I'm good.
I don't know if everyone knows Farah.
If you'd allow me, Gonçalo, I would like to do the introduction in Arabic.
Oh, sure.
And,
please.
For all our Arabic speaking guests, and I apologize for our non-Arabic speaking guests. I promise I will talk more about myself in English during the panel. السلام عليكم لحضوركم معنا اليوم في الفعالية الأولى من نوعها، واللي تشمل أكثر من 500 شخص من أكثر من 40 دولة حول العالم. اسمحوا لي أن أعرف عن نفسي. اسمي فرح القيسية. أطلقت مبادرة stutteringawareness في 2013 بهدف أن أساعد الأشخاص المتلعثمين في الدولة في الإمارات أنهم يتعايشوا ويتقبلوا التأتأة، والحمد لله انتشرت لعدة دول برا الإمارات. وفي 2013 أطلقنا منصة إلكترونية لعلاج التلعثم اسمه Stuttering Center بالشراكة مع مركز سبيتش كير البرتغالية، ونطمح في 2021 أن نطلق دورات تدريبية للأخصائيين النطق. ومنذ إطلاق مبادرة stutteringawareness لاحظت أن زاد الوعي في المجتمع عن التأتأة والتحديات اللي يواجهوها الأشخاص اللي عندهم التأتأة، وزاد الفهم والتأقلم معها. ونطمح مع Stuttering Center إن مش بس نقدم جلسات لأخصائيين النطق عبر الإنترنت، بس بالإضافة التعاون مع دول أخرى اللي تساعدنا في نشر هذه الرسالة. آمل أن لقائنا اليوم يزيد من معرفتكم عن التلعثم والتحديات اللي يواجهوها الأشخاص المتلعثمين، بالإضافة إلى طرق المعالجة للتلعثم. أشكركم للحضور اليوم، ودمتم بخير وسعادة. شكراً. Thank you, Gonçalo.
It's a beautiful language, but I don't get a word. I understood speech care, Stutter UAE.
You got the main point.
I Stutter Center, so I believe I have the key points. Thank you so much. So we welcome everyone, and we know we have people from several countries, and I'm quite sure it will be 2 amazing hours of sharing and learning. So we will start, and you can put some questions in the chat and in the Q&A box that our speakers will try to answer during their talk. I will moderate them, so when depending of the topics, I will put some of the questions during the conversation, and some of them will keep some time to the end of each panel to try to answer. Of course, it's not possible to answer all the questions, but we will give our best. So for the first panel, I will be very, very happy to call, let me just, sorry, to share with you. Okay, so in this first panel, we will have Scott Yares. Dr. Scott Yares he's professor of communicative science and disorders on the Michigan State University, and also have a wonderful, wonderful page called Stuttering Therapy Resources, when I recommend everyone take a look on amazing books and resources in a very kind way. Professor Scott shared with us. And Annalise Bonnen, she's the director of the Brazilian Fluency Institute, and also a very dear colleague and friend. So I give the welcome to Scott and Annalise to join us in this conversation.
Hi, everyone.
Obrigado. Merhaba. Nice. Thank you, Gonzalo. Salam all. Buenos dias, bom dia.
Thank you so much. Thank you so much for joining us. Do you know any words in Arab, Scott?
Just merhaba, salam. That's it.
That's
sorry.
Nice. That's nice. That's really nice. So we will start. Right now, I will challenge our audience with a question that I believe people right now are seeing in their panels. And what we really want is everyone to vote and give their perspective. I don't know if Scott and Annalise are seeing the question.
Yes, we are.
Yes, okay. The question is, at what age can stuttering be diagnosed? So we have the first answer is after 6 years old. The second is 1 year after the beginning of stuttering like these fluencies. The third one, 6 months after the beginning of stuttering like these fluencies. And the last last question, as soon as stuttering like these speech fluencies came up. So it was me the responsible for this first question, because I believe it's a major topic for our colleagues, for families, for pediatricians. So I believe it's a really, really nice starting point. And thank you so much, everyone is voting. I will give them more 15 seconds to finish, but we are seeing more or less we already have a nice sample, so I will share the results. Okay, we have already in our screen, we have different answers. What do you both think about this?
Who's going first? Me first? Well, this is a wonderful question, because we, as speech pathologists, receive these questions very often. And I'd say that as soon as possible, and I mean as soon as yesterday, because stuttering is a chronic condition. If we do not see it as soon as possible, we will have a chance to have a chronic condition. So why will we wait? There is no reason why we should wait. I know we have a lot of knowledge about the risk factors that stuttering has, but people who are not familiar with stuttering, including pediatricians, a lot of speech pathologists, doctors, and teachers, psychologists, people that really do not understand, because it's not their field, so it's not exactly an obligation. But we that are specialists in the field, we are supposed to know that it's a chronic condition. So we do have an obligation, a professional obligation, as I think. If it is chronic, why will I wait after 8 weeks. If after 8 weeks, the child has not decreased the number of stuttering-like or just fluency-like speech, why do we wait? Oh, people say that we'll have a spontaneous recovery from, yeah, it is. The majority of children who recover spontaneously are girls. The proportion is 4 males or 4 boys for 1 girl. So with the boys have a smaller chance of spontaneous recovery. So why do we wait? Why do we wait? I will not. Sometimes people think I'm a kind of radical about that, but after 8 weeks, it's a rule of thumb for me. After 8 weeks, nothing improves. It's there or even getting higher. Please do not wait. If you are parents or speech pathologists or pediatricians, go look for help. Reach out for help, because this is what I think it's very important to do. And we have the chance to not, we do not allow children who stutter to become adults who stutter.
Very good. So now changing to Scott and sharing a little bit something that I see a lot of colleagues that for them it's very difficult to understand if are these stuttering what we are looking at? Are these normal disfluencies? Are these related with language development? For all these colleagues, how you will advise them, and I know you're doing like an amazing work, you have amazing research, very recent, defining all these stuttering moments, how you will advise these colleagues in clinical practice, how they can see it.
Excellent. Thank you, Gonzalo, and hello to everyone out there. I'm thrilled to have a chance to participate in this, so thank you for that. And it's a tremendous question because young children tend to be disfluent anyway, just typically, normally, because their brains are still developing, their mouths are still developing, and an interruption in the flow of speech is a normal thing that we should expect to happen, just as they fall down and trip when they start to run, or they color outside the lines when they're drawing a picture. It's just a normal part of development for children to be disfluent. But the key is that some of those children are experiencing a different type of disfluency. And those are the ones that we want to be cautious about, because those are the children who are at risk for stuttering.
Yes.
And a lot of research has been done over decades, truly, trying to figure out which children will stutter and which children won't. And it's a problem because there is no simple way to sort them. There are complicated ways to sort them, and that's where we as professionals can come in. Fragmenting the words themselves, not maybe repeating phrases so much. That could be language formulation, thinking about what they want to say. And while that may be a concern for a child who has a language development issue, that's not stuttering in a young child. What we're looking for as stuttering behavior in a young child is that sense that they're stuck. When we ask adults who stutter what that moment of stuttering feels like to them, the phrase that they use is, "I've lost control. I'm stuck. I'm unable to move forward." That seems to be really at the heart of the stuttering experience. So if you see a child who, who, whose disfluencies seem to indicate that they know what they want to say, they're just unable to say it, then those are the ones that we're concerned about from a stuttering perspective. It's not always easy to differentiate. So, like Dr. Bonin, I tend to take action very early. I don't like to wait. I want to make sure that we cast a wide net so that I'm going to mix my metaphors here so the children don't fall through the cracks. Yes?
Yes.
Very good. like we have children who have like very low risk to probably become to stutter all their lives, and others we have children with very high risk. So what are these factors, Annalise, in your perspective, that our colleagues should be very careful and to collect all this info?
Okay, well, we have the classic risk factors, and I know there have been research that are going on in trying to clarify better what the real risk factors could be so that we don't miss anything. First, genetics is important. We have been receiving a lot of information from genetics in terms of the importance of this in maintaining stuttering in a family, for instance. Brain studies with Dr. Shang, for instance, they say, well, the differences between girls and, well, risk, genetics, gender is important, age of onset. I don't know if you have been encountering this, but here in my experience here in Brazil, we have encountering very, very young children, even with less than 2 years old, that begin to stutter. And the doubt is this stuttering or this is just a non-fluent speech? And I have a question with the word this fluent and this fluency because it causes a lot of confusion to a lot of people. So I'd rather say non-fluent speech so that we can sort out if this is something that is normal, like, you know, Dr. Yars just said, or if it's not. So a very good differential diagnosis that it's on call too. But genetics, gender, age of onset, family history, environmental factors that sometimes contribute to increase. So these are the most important things, but a lot of other things that are, you know, in a lesser aspect. We cannot miss those, at least.
Sure, totally. Scott, what do you think? Some of a lot of colleagues, they ask how we talk with families of a very, very young children about this. How, and let's say a child with 2-3 years old, and we have, unfortunately, some pediatricians to the wait and see. So it's us against them, more or less. So how to manage families at this topic?
Excellent. Another wonderful question. It's understandable that the pediatrician gives this advice, even though it's not the advice I wish they would give. Because even though many young children do start to stutter, as you were just commenting, many of them recover. And so when a pediatrician sees children coming in to his or her office, stuttering, most time they say, no, don't worry, it'll go away. And a good percentage of the time, they're right. It does go away. But that group individual child that we're working with. So the first thing I explain to parents is that 75% recovery may seem like good odds if you're going to play the odds, but not for my child. No way. I'm not going to just take the risk. But the second thing I explain to them is that historically in our field, even professional speech language pathologists did recommend waiting historically. Decades ago, there was a very prominent theory and the idea of not treating children too young for fear that that would introduce problems of its own. We know today that that theory is false, but just because we know that doesn't mean that other professionals have necessarily learned that yet. So when it comes to the us versus them, speech language pathologist versus the pediatrician, I point out that our field have learned about stuttering. I don't have to disrespect their pediatrician. I would just say that our field has grown and learned, and that's the beauty of science. Ideally, what we know today will be outdated in the future. And that's just what happened is we learned more. And so now we act earlier, the sooner the better, the younger the better. And maybe the child will still recover on their own.
Yeah, and who is able to tell us, though this one is will recover? We do not have that for sure. We do not know. So ethically, I wouldn't say let's wait, because well, this is not what our profession is all about. If we have to prevent stuttering from becoming chronic or a chronic condition, as soon as possible is the best answer, and it's a very good answer. Thank you for that.
So we start to discuss the when. Now let's move to how. Okay. So I don't know who want to start with the how. I don't know.
Well, this is the first thing we have to do in how and when. We are doing this right now. We are, spreading the news, sharing knowledge, making people understand what science says about stuttering, especially with young children. And so I think we have said the most important answer is when, as soon as possible. Do not wait. Ask an adult who stutters if he would have been better if he had been treated when he was a child, and then you wouldn't be stuttering maybe now as an adult. So this is easy to understand. So as soon as possible. How? I'll leave that to Dr. Yares because he's the expert. And there are so many ways of doing it, working with the family to begin with, and then with or without with the child. But so he has books and everything. I'll let him talk about that.
Well, wonderful. Thank you. This is an important question, particularly because many speech language pathologists worldwide don't feel confident. They may be beginning to feel confident about, all right, I know I need to get involved. I know I need to intervene and I need to do it sooner rather than later. But then they don't necessarily feel confident about how to do that intervention. So what I want to do is provide a broad overview of some options. Because the good news here is that we do have options. There are different opinions about the best way to treat young children who stutter. And sometimes we may worry that those different opinions are confusing to people or it seems like a conflict, but that's not how I view it. I like having options because what that does is it gives us the opportunity to tailor the therapy for each child's and family's unique needs. So I think of therapy in these broad categories. First, many clinicians may begin therapy with work designed to help the child be more fluent in his own environment. We can identify that some things make it harder for a child to maintain fluency. These don't cause stuttering. They take existing stuttering and make it more difficult to manage. And so many clinicians have a component of their therapy where they work with the family to see what makes it harder for the child to maintain fluency on a moment by moment, day by day basis. These are often things like a lot of time pressure for the child to rush to communicate, a lot of complexity that the child may be trying to express, maybe negative reactions or competition for talking time. And very often we can help parents identify those things that make it harder for the child to communicate. And then we can brainstorm ways of reducing those demands. That falls into the category of what you might call less direct therapy because we haven't yet taught the child to do anything with his speech. Okay. The interesting thing is that for many children, that's all that's needed are these less direct aspects, but not all children. Some children need more. And there's a question that's come up on the chat about, well, what if we're talking to a young children about his stuttering? Could that increase awareness? Indeed, that was what our field believed once upon a time. But today we know that helping children understand what they're experiencing actually helps to reduce their concern and improve their speech and communication. So a second aspect of therapy is attitudinal work, even with a very young child. The third aspect of therapy then, for some children, would be more direct work on their speech, helping them learn specifically how to enhance their fluency. And what I do is I draw from these three components on an individualized basis. Some less direct therapy, some more direct therapy, and actually most of the time attitudinal work to help reduce fear.
What I would like to add here and is that we also need specialized speech and language therapists, because I don't know in your countries, but here our the formation of the speech pathology is very broad, and we do not have a lot of knowledge about stuttering itself within this speech pathology clinical work. So we have to understand that we need to get knowledge how is to begin to study and have a deeper knowledge about what stuttering is all about, so that it reflects in a better clinical thinking and in clinical decisions of what we have to do. So if we want to go where Dr. Yaser is saying now, which is just perfect, we have to have previous knowledge and understanding of what is going on in the field. And because stuttering is a multidimensional thing, we have to learn a lot of things from a lot of people and to qualify our work as a speech pathologist.
Very good. So we have already some questions of our audience. Some of them, I believe you both already answered. Fatma was asking about child awareness in early intervention, if it's that it can make the stuttering worse. And I believe Scott already talked about that, and talk also about the how important it is to approach the attitude of the child. So Lynn, she's asking if it's possible, Scott, for you to expand a little more about this attitudinal approach you're talking about.
I would love to. It's one of my favorite topics. So thank you, Lynn, for that question. Because historically, we really thought we weren't supposed to do this. I know when I was a student, and although it may look like it, it wasn't that long ago. When I was a student, we were taught, don't draw attention to it. You don't want to make the child feel bad. But what we've learned instead is that if we don't want the child to feel bad, we can explicitly tell him that he's okay. What I do in that attitudinal aspect of therapy is educate the child about talking, even at a very young age. It turns out that even little 3-year-olds can learn about how we talk in a beginner's way, certainly, but they can learn that we need to breathe in order to talk. They can learn that we have our voice, and they can feel the action of the vocal folds. They learn that they have to be able to move their mouths to talk. And they can learn in this context that sometimes the muscles work together, and sometimes the muscles are fighting against one another. And when that happens, that's okay. It's part of learning to talk for them. And it's just like other difficulties that some children may experience. Coloring, running, drinking out of a big cup, writing. They're going to experience mistakes. Not that stuttering is a mistake, but it's an okay way of explaining it to a young child. They'll experience times when they're having trouble doing what they want to do. And when that happens, we don't get upset. If a child colors outside the lines, we don't get upset about it. We don't worry about it. But if the child is worried, we tell them it's okay. It's just part of learning. It's nothing to be ashamed of, and it's nothing to be afraid of. And in setting the foundation like that, the child learns that even when there's a disruption in my speech, I don't have to feel bad. Our goal is to prevent the development of negative attitudes. And we now know today, whereas we didn't know this years ago, that we can help them with that directly and specifically.
And if you ask a 2-year-old what is going on with their mouth, they will answer, my mouth gets stuck, I cannot breathe sometimes. They can answer in their own simple way and show you where you are stuck. It's really easy to say that. And they show you, they probably won't have the right words and say, oh, my mentor here is stuck, but they will tell you what is going on. And usually after we explain them that this is okay and it's fine and you're learning and everything else, they will get so relieved because now somebody understands what's going on with me. And usually stuttering comes down. And I think Dr. Yaris would agree with that. And parents also get so relieved that the whole ambience type of thing gets better, improves, and we have more room to work with and work with them.
Very, very good. We have more questions, and I will try to put them together. We don't have that much time, but we'll try to answer one. It's about children who stutter and have other disorders. We have someone here that are talking about a child who she is on the autistic spectrum, only at word level, but it starts to stutter. And her question is if we can consider stuttering. And we see a lot of people, also in Down syndrome, also the disfluencies, and they ask if it's considered stuttering or if it's something different. So this is one part. The other part, it's about, in this case, comorbidities between stuttering and other disorders, like language delay or also phonological disorder. What can we expect of therapy, and how can we integrate the therapy of these children?
You go on.
You want me to start with this one? Great, excellent. Yes. We're such a great team. We're thinking the same things, and it's really fun. Thank you for this chance. This is a great question, because we know that many young children who stutter don't just stutter, right? They may have other things going on. In school, we teach about these different conditions in these neat and tidy categories, but people don't exist in these neat and tidy categories. What I try to do when I see a child or an adult with multiple diagnoses is ask myself this question. And I apologize, my dog has chosen this moment to wake up. I ask this question: what is affecting the child's communication the most right now? In some cases, that'll be the stuttering, in which case I'm going to shade toward working on the stuttering, well, while not forgetting the other conditions. But in some cases, it may not be the stuttering. If you have a child with a speech sound disorder who is hard to understand, well, it does a child no good at all to say something fluently but unintelligibly. And so people have to ask him to repeat himself anyway. So sometimes I'll shade toward the other condition, recognizing that the stuttering may fluctuate a bit during that time, and it may even increase. But if the goal is communication, then I'm okay with that. I focus on acceptance of the stuttering while we work on increasing the success and the effectiveness of communication. It means that we might need to swap back and forth quite a bit. It's a challenging job for the clinician and for the parent and for the child. But if we take that communication orientation, then overall we can help a child move toward being able to express himself more easily. And that's what we want, regardless of whether he stutters, regardless of whether he has a speech sound problem or a language problem or some other diagnosis. If he can communicate successfully, then we're on the right track.
Yeah, I agree with that. We have to prioritize also, because depending on the health system of each country, sometimes people cannot have 2 or 3 different specialists to work with at the same time with the child. And sometimes we have to prioritize and see which one is more important at this point in time.
Very good. So, and a lot of people, they ask, and we have also questions about here, so I believe it's a nice point. Some people saying like, I'm treating this child, this 4 years old child, and I believe that this child doesn't have awareness that he stutter. So this is always a point. Does the child are aware that he or she stutter or not? And how can we measure that? What do you think, Scott?
Another of my favorites. I want to be judicious in how we approach this. I don't think we necessarily need to talk to all children about their stuttering all the time, always. Because in truth, there are some children who may be stuttering but have no negative reaction, no awareness at this point. I mean, I've got problems of my own that I'm not aware of, and I wouldn't appreciate it if you started pointing them out all of a sudden. So it's okay if the child is fine. We don't need to bring it up. But very often, young children who stutter are not entirely fine. When they're frustrated, when they say things like, I can't get that word out, or what's wrong with me. Even little 2-year-olds, I've seen them say, no, I can't say that. You say it for me. That's too hard. And in those situations, what I want parents to feel comfortable doing is expressing to the child the same support that they would if the child had instead said, I can't ride my bicycle or tricycle. I can't color a pretty picture. I always spill my milk. In those situations, the parent reassures the child and builds up the child's confidence. We need to do the same thing with stuttering.
Yeah, agreed. Perfect.
Annalise, what do you think? We are almost at the ending of our panel. What will be the take-home message about when and how?
Oh, when, briefly, as soon as possible. Do not wait. Please, if you don't take anything else home with our panel today, take this message. Do not wait. Go on and reach out for specialized help. And how? Well, studying a lot for speech pathologists, and parents do look for somebody that can help you understand what is going on so that we can take diagnostic and therapeutic measures that will help the child to hopefully overcome.
And you, Scott, take home message?
Treat early and often. Don't wait. Don't wait. And let everybody involved, the child, the parents, and even you, us as the clinicians, know that it's okay for the child to be stuttering. This is not something that we need to approach with fear and alarm. This is something that we can approach in an open, accepting, positive way, because that'll help everybody feel better and ultimately do better.
Yes, this is wonderful. This is the message. I thank you so much.
I believe the message it's received because we have done this question, and like we can see, almost around 92% say as soon as possible to start. And of course, there's a lot of things that we can do. We need to study more, learn more. And I want to thank you so much for accept this challenge of, in the small amount of time, sharing so many good ideas and thoughts and way to go. Thank you so much, Scott and Annalise.
Yeah, thank you so much for having us here. We at IBF are very, very happy to be part of it in this group, this so nice group. Thank you, Scott, and thank you, Gonçalo and Farah, and everybody else who is starting to promote this.
Everyone will have the chance to see more of Annalise and Scott in the NSA conference that we will talk a little bit at the end. And so everyone will be invited in November. Now I forgot the dates, but we'll share it. I'm horrible with dates. So thank you.
19th and 20th, I think, of November.
Okay,
and
perfect.
And 21 November, yeah.
Yeah, and that,
yes.
I will then share with everyone so everyone can put on their list things to do. Thank you so much, Scott and Annalise. See you next time. Ciao.
Take care. Thank you.
So now we will move to the next topic, and it will be a pleasure. Let me just share. So it will be my pleasure to call Dr. Gerald, Dr. Yaser, and Dr. Charlie to join us. So Dr. Gerald Maguire, he's professor and chair on psychiatry and neuroscience on the Riverside School of Medicine, and also chair of the National Stuttering Association. My good friend Jerry, hello.
Hello, how are you, Gonzalo?
I'm good.
Great.
I'm good.
All right, thank you.
I hope you're good too. And,
I'm doing well. I have my Starbucks coffee. Oh, but I should have grabbed my Lisbon mug. I'm sorry.
No problem. No problem.
I know, right? It's good, right?
It's really nice. And also we have Charlie, clinical assistant professor at the University of South Carolina, also National Stuttering Association professional relations chair. I believe Charlie
I'm
is
here.
around.
I don't know why
okay.
the video is not working. I can hear you.
Oh, but the video is not working. I don't know. We'll see if we are solving it. And I believe we don't have yet Dr. Yaser with us, so we will start, and then let's hope Dr. Yaser can join us. I don't have any problem. And first of all, thank you so much, you both, to accept this challenge. It's always so nice, our talk. So I didn't have that much opportunity to chat with Charlie. So I'm very excited to have you here too. And with my good friend Jerry, we changed these discussions in a lot of places. And also one time in Dubai, right?
Well, we were in Dubai in the end of 17 or 18, I think. Yeah, that's right. Wonderful. Yeah.
It was really, really great.
Yes, it was great.
We are starting the panels with a question to the audience, and I will do the same here. And I will share the question. And the question is, can anxiety and nervousness cause stuttering? This is the first question that we are asking to our audience, because we know this is a tough topic. And it's before in the previous panel, we are talking about early intervention, that it's quite normal, like families, they show up and they say, my child is very nervous. He wants to say everything at once. And mostly when he's very anxious, he stutters a lot. So, and we still, we hear a lot of this, even for professionals. So I believe it's something that it's not clear, and it will be really, really nice to have you both to discuss this with us. So I will share the answers. I know more people were answered, but this is nice to start. And as we can see, the answer, it's not clear. It's like to put the coin and do this. So
very interesting.
Yeah.
What do you think about this, Jerry?
Well, I'm going to say it's not clear, and that's the right answer. What did I just say here, right? But I'm just going to say how, right? So anxiety and nervousness at least make stuttering worse, and it can coexist. And I believe my good friend Charlie will likely agree with me here in that so much of our forms of therapy are around the social anxiety around this. Now, my good friend Gonzalo, right? You presented a great presentation to my own faculty in Portugal about the link of what controls the anxiety, right? We look at the cingulate, the amygdala, and how that affect when anxiety's higher, the speech fluency, if I may use that term, can be made worse, right? So we even understand from a biologic standpoint. So the answer to me is anxiety doesn't necessarily cause stuttering, but it can make stuttering worse. And then through the psychological aspects of stuttering that we have, the avoidance, right? The cognitive demands on speaking, that can make the anxiety worse. So that's where working in my discipline of medicine and psychiatry as a physician, the work that I do is not just to look at the biological aspects of the social anxiety too, and work there, but also on the psychology aspects, the cognitive behavioral therapy and other things. And then my good speech language pathology friends work on that aspects as well too. Being a child who grew up in speech language in speech therapy from second grade all the way through high school and then into self-help and college, looking back on the therapy before I was formally trained in psychotherapy, much of that was cognitive behavioral work that we were doing and working on the avoidance and the acceptance. So all of this is in one, that the anxiety and looking at the biology and the therapy, just that, and anxiety makes stuttering worse and stuttering can make anxiety worse. It's not necessarily a cause, but there are neurophysiologic connections with those, and we can affect those through biology and therapy. And I look to my friend Charlie about that as well.
Yes, absolutely.
Yeah.
Anxiety can exacerbate stuttering, but it's interesting because when you see people who don't stutter, in certain situations where they're more nervous or anxious, they might do something that sounds like stuttering. And that's why, unfortunately, people who stutter are suspected of maybe being a little misleading at times when they stutter, which is really unfortunate.
That's right. Thank you, Charlie.
And Charlie, how, in your perspective, and explain people when they came to the first meeting, what we know right now about stuttering is it's a kind of an adventure, because we have a lot of pieces of the puzzle, but put it together, it's a major challenge. So a very practical question, how you discuss with your clients this topic?
Of where stuttering comes from?
Yeah, and when they ask you, like, why I stutter? Why me? What's going on with me?
Well, I guess I try to steer them away from why me and think more about where we're headed. And hopefully they are already recognizing some of the strengths that come with overcoming stuttering and enduring stuttering.
Okay, and how is your experience about this, Jerry? In your I know you do mostly research and you don't do clinical practice, but I know a lot
that's
of
not true. That's not true. That's not true. No, I treat a lot of. That's why you can never. Okay, we were trying to set up a Zoom yesterday, my friend, and you're like, I only have 12 noon because that's my lunch hour because I see patients all day Fridays and Mondays. Yeah, no, I actually do that. Right, I work with Lauren and Lisa. They do the speech therapy. I do the medications, the psychotherapy, the CBT. That's right. So sorry. Let's
go on that. How you see the teamwork? Right. How you see this multidisciplinary team to work in stuttering? What is your perspective about that?
Got it. Because I've even done that with my friends in speech care in Lisbon, but we're not going to go there, right? So yeah, you bring up this good point, because clients, right? They're clients when they see Lauren and Lisa, and they're patients when they see me. But that's just how it works with it. So people who stutter, especially parents, they're coming like, or even people now, when we published that article that came out about 2 weeks ago, it's always a question of, why do I stutter? And it's, I guess, can't tell you, it's not one size fits all. We know that. My good friend, Dr. Alm, I think is on this call, right? We're understanding. He's put together a great paper. I want everybody to read that. Stuttering, we believe, can come from multiple causes, right? There's the genetic causes, right? And I think we'll go forward. There's going to be multiple genes, right? It's not going to be, we know even from Draina's work, that's a different gene than what our friends found in China, right? So it's not going to be one gene. And even that one work might explain 10% of people, right? And then there could be an autoimmune issue. And our good friend Pear really put together a great paper. Look at that. So it's going to be multiple. And what I do when I approach people is I say, we have too much stigma around stuttering. There's too much discrimination. There's too much misunderstanding of this. And there's not enough acceptance in the world of people's stutters' abilities, right? People look at our disability, but it's also the lack of the understanding of what's going on with our brains and why we are different. So the understanding of the diversity understanding is understand what is in our brain, what makes us unique and different, and accept that. So how we say the difference is that is, well, I got to know and I got to look it up. And very soon, I really think in the next 2 or 3 years, we'll be able to subclass different types of stuttering. And that's going to be there. And then for individuals, when I do my thorough examination, working closely with my speech language pathology team, we look at this and I say, okay, this is likely a form that may benefit from some added medications, right? This is a person with some social anxiety. This is a person with a lot of tick motions. This is a person with persistence into adulthood in the family. And this is a child after 3 or 4 years is not responding. So therefore it makes sense. And then you look over there and you work with Lauren and Lisa and you'd say, okay, we're going to work together. And they'll say, hey, Jerry, I really think I could do a lot with speech therapy. And then they go and say, you know, this guy's got so much avoidance. That's where my psychotherapy comes in, right? So you work as a team and we understand to the parents and to the person. I've had countless, hundreds of patients who come to me and say, now this makes sense. Now I understand when I sing why I'm fluent. Or now I understand when I'm anxious, I get worse. The model, understanding the biologic model, allows one to accept. It brings in the focus of decreasing stigma. And we're all one, and we show that we work together as a team, just like any other nervous system condition. Working in a comprehensive, interdisciplinary, collaborative team is the best that we have. Stuttering will not be different. Depression is this way. Multiple sclerosis is this way. This is where we are. And I thank you because this is what it's all about. This is the education of bringing everybody together. And that's what I do. That's what I work with the patient, the client. It's education, understanding the biology, understanding the psychology, understanding the importance of speech therapy. And then we are good to go. So
very good, very good.
Thank you.
So, no, come on, Charlie. And when it's not possible to have this amazing team, like we are lucky to have Jerry and other psychologists, there are not that much, at least in my experience, who are aware about stuttering. But when we have only the speech therapists, and we know it's a key point to work acceptance. What do you believe it's like what a speech and language therapists need to have in mind to work that, in your perspective?
That's a great point. As speech therapists, we also have to be counselors as well. We do a lot of counseling, especially with older kids and adults. And the best thing I think you can do is to get your patient among other people who stutter. Early on in my career working with people who stutter, I recognized that they needed something that I could not provide them because I don't stutter. They needed that sense of community. And so early on, I established a chapter of the National Stuttering Association. And that's been an invaluable component to the treatment that I offer, is to find that community and to understand from them that it's not a death sentence and that there's nothing wrong with stuttering. And Jerry mentioned diversity, and it's neurodiversity, right? We're seeing the neurodiversity movement involved with the stuttering community, and that's been a wonderful thing.
That's right. That's right, Charlie. As we look at that, the neurodiversity movement works very well with the biologic model and the psychology model that we all understand. We understand we're unique, we're different, and then what that does, as we're finding out here, that's the acceptance. That's where the society, the employers, the academic understand It's all together. They're not mutually exclusive, as we know. And so these movements together, working as one, is what's really going to bring our stuttering community together, be able to us. And my other role as a chair of the National Stuttering Association, of course, is to bring the stuttering community together, empower the stuttering community through understanding and advocacy and education and research and treatment and support. And I look here and I just want to thank all of you for bringing the world together in understanding this, to understand the biologic underpinnings, the growth of treatments. I really do think in the next 2 or 3 years, we're in FDA trials right now with biologic treatments. And then I'm working with other colleagues. I'm very confident very soon. One of these many medicines and treatments and other biologic treatments that you're using, it's not just medicines, as you know, Gonzalo, we're using other biologic treatments. We'll be working in tandem with our psychotherapy. As Charlie says, they're counselors, that's psychotherapy, working with our speech therapy in unison at the same time, empowering the community with advocacy and understanding. And my good friend, Gonzalo, you brought up the good point that physicians, my colleagues, don't know much about that, but don't know much about stuttering. That is our next frontier. And that is why we're going to have the National Stuttering Association Global Conference coming up soon, is to reach out to the medical community such that they understand the important role that they will be playing in tandem with our speech language pathology colleagues, our psychology colleagues that's coming forward, and to understand that when they see a child who stutters, just as what you brought forward in the earlier panel, refer that child for excellent speech therapy and psychotherapy if it's older and if there's issues of avoidance and everything else. So I thank you for bringing the world together. Through these mechanisms, we will educate the world and we will decrease the stigma and increase the understanding, and we will empower the stuttering community. So thanks.
Thank you so much for your words. You're talking about the research that you're doing with the medication. Can you talk a little bit more about what can we expect? What will be a good result?
Got it. Okay, I can even. So it's not just about medications, right? We're doing quite a bit. I can only share with you what's public at this point, right? Because we've got a lot of other things behind the scenes. I look to my great colleague and Dr. Alm, right, who published. I just thought everybody check out the special issue of Frontiers Neuroscience. There's a lot of really cutting edge research on stuttering. I invite everyone to look at that, to actually review. A lot is going on, understanding the biology of stuttering and the best treatments that we have and understanding. So part of our research here that we're doing right now is what's called a late phase 2, early phase 3 trial of medication in the treatment of stuttering. This medication is ecopipam, and we have other ones coming down the pike too. That's not public yet, but this agent works on a different receptor to the dopamine system, right? And we've actually looked at past 20 years. We've had agents, so we've published every study that's ever been done. Also, these studies have been done in Iran, and they've been done in China and others that have shown efficacy, even go back to the 1970s, of dopamine agents being effective in stuttering. There's never been a negative study published all the way back to the 1960s of dopamine agents. But there's never been, as you see now with COVID-19 vaccines being developed, you might develop one from a university like the vaccine from Oxford. It requires a pharmaceutical company, unfortunately, this is our drug development of the world, to sponsor that through the regulatory agencies of the governments, the US government and the EU and the rest of the world. So as that's going on with COVID vaccines, we're learning about phase 3, double-blind placebo control. That's going on now with stuttering. We have our first multi-center trial of a new compound, ecopipam. This one is just being held in the US. We're beginning enrollment October 1st. That's next week. Hopefully have data within, we're warp speed, but we're not quite as fast as the vaccine, but we're going to be there, right? I'm saying this is top priority. So we're working fast. I hopefully have data, positive data. I hope if it's positive data and it's tolerable, say in the next 10 to 12 months, larger study, global study, hundreds of patients around the world, multiple continents. And if that's positive, it'll be, if it's positive, if those two are positive around the world, right? Medication treatment, 2 or 3 years, maybe 3 on the horizon. And doctors will prescribe, they'll work interdisciplinary with speech pathologists, et cetera. And then we got other things coming down the line too. So you'll see, and what I really see is just what happened in my field in psychiatry on obsessive compulsive disorder. When that condition got its first medication that was FDA approved, millions of patients came out of the woodwork worldwide and said, this is what I have. I've been sitting in my room. I've been avoiding everything because there was no hope. There's no treatment. And then they came in and they started getting the treatment. And then they went to the psychiatrist and said, well, you know, to really get better here, you need psychotherapy. So they go to psychotherapy and they do better. And then we do studies that show that the medicine affects the part of the brain called the caudate nucleus. And the psychotherapy affects that part of the brain the same way, the caudate nucleus. And then the study showed if you use both together, the patients got even better. And I know I'm thinking outside the box, but I really believe, and I'm working on studies with people here, that that's going to be the future. That when we do get these medicines, I'm going to say when we do, millions of people around the world will say, yes, I'm there. They'll go for help. They'll start with a speech language pathologist. Here it is. And I really think our paradigm of understanding treatment of stuttering, we're going to be empowered more, and we're going to bring everybody together. And that's what I look forward to.
Very good. Very good. Thank you. So I shared a question. Now I will share the answer. And what we ask to our audience is the single biggest objective of speech therapy should be achieve fluency. And we have these results. Can you comment, Charlie, and share with us, in your perspective, what should be the major objectives when we are doing treatment with adults?
This is a great question. Thank you, Gonzalo. No, it should not be, fluency should not be the goal. Ease of communication, effective communication, ease of speech, these are the outcomes that you really want. And so it's all about shifting, a paradigm shift in the way that you feel about stuttering. And that takes time.
Yeah, sure. And what about, Jerry, I discussed this with you so many times. I see a lot like people who stutter and also have OCD, people who stutter,
right,
and also have depression, anxiety disorder. What you will advise to my colleagues, speech and language therapists, how can they do the referral?
Wonderful, great.
How do you believe they can contact a psychiatrist, or what do you think about this?
Good, it's wonderful. This is where we're going, right? This is where we need to be. Is this coordinated effort, right? What we actually have in the depression world and in the OCD world and in the Tourette's world, which is a less common condition of the brain than what we have of stuttering, very similar though, is that we have to develop a consortium of speech language pathologists as the primary, right? You get the referral at the children. They may go to the pediatrician, right, or the family physician first, right? But we want to make sure that we educate enough of my colleagues in the medical field to refer to a great speech language pathologist, not just anyone, someone who understands stuttering, right? Get that good care going. And then that speech language pathologist will say, just like Lauren and Lisa, my colleagues out here, Dr. LaSalle and Lauren McGill, who are both specialized in fluency, will say, hey, Jerry, and I've been treating this kid for 5 or 6 years or 3 years. He has some obsessive features, or he's got a lot of depression, or it's a 21-year-old with depression, or what's common, attention deficit disorder, right? So all these, right, we look biologically are conditions that are linked with stuttering, similar regions of the brain. So that's where I can come in, right? Or a psychiatrist that you work with. Now, just be mindful, many physicians around the world they do not understand stuttering. And I also want to caution everybody out there, if you read my research and say medication A works, don't run to a pharmacy and take it, right? You got to understand it's got to be under a doctor's order and guidance because different doses are different things and different side effects in different people, and one medicine won't fit all, and not everything's could work for everybody. So we have to educate the doctors. And then I believe we have to develop a consortium. You and your office are right there. You have a neurologist right upstairs. Work closely, find people. This is how it's going to work. So at that point, get the referral. Now I look here too, right? Dr. Rahm, right, has a great screening form, right? In his recent article, looking at a screen for what we now know is a cause of stuttering, which is the autoimmune, it's a less common cause, we believe, of a child that may have a post-streptococcal cause of their stuttering. Great screen form. I invite you to look at that. And then work with my colleague, Laura McGill, on when to screen in a child, right? And develop these things of when to refer to that psychiatrist. So we got to do better at screening. I would say if your therapy is no longer working, you're hitting a barrier, or if that child has other conditions, or that adult, OCD, ADHD, social anxiety, major depressive disorder, refer, work as a team. And that's it. Yeah. And then it's constant communication back and forth. You're going to work. It's not like there's a cure for stuttering, be it a therapy or a pill. It's treatment. And don't let any doctor out there say they cure much. We treat diabetes. We treat hypertension. And that's what we do. That's what we do. We're going to work together. We're going to treat it. For those that persist in adulthood, stuttering is lifelong. We'll treat, therapy, medicines, what we do. That's it.
You said so many important things, and one of them it's about the differential diagnosis. That sometimes people come to the clinic, they are diagnosed as like Tourette syndrome, and we see that it's stuttering, and sometimes of course the opposite also happens. Right. And my question is for Charlie. I know that Charlie, you have done research and you're very close to the cluttering. And I know this is a topic very difficult for a lot of colleagues. Some of them have a lot of difficulties to do the diagnosis. So what can you tell them about this? How, in your perspective, what should they do, and how they can learn more about cluttering?
Thank you, Gonzalo. Great question. Well, they could learn more by finding us on the internet. The International Cluttering Association has lots of great resources on cluttering. Cluttering is a disorder of fluency. It is not the same as stuttering. It can co-occur with stuttering. You can have someone who clutters and stutters. Cluttering is generally considered to be a disorder of rate, rapid or irregular speaking rate. It emerges a little bit later than stuttering typically. It's less, we actually don't know how common it is. It's often misdiagnosed as stuttering. Lots of great information on the website.
Yeah, the next World Conference in stuttering, it will be together, stuttering and cluttering, right?
Yes.
In Canada, I believe.
That's correct.
Okay.
In Montreal.
So in Montreal, it will be nice. And we have some people, Sarah, it's asking about, what about electrical stimulation? I believe she's talking about TDS.
Yes.
And what do you think about that, Jerry?
Hey, there's someone on the other end of the Zoom who knows that better than I do. So do you want to actually chat about that? I actually go to the host who's actually done a little bit more work in that. If you want to actually answer that. But also to say that, yeah, you're right. It's not necessarily a medicine, right, that can affect brain physiology on stuttering. Magnets, electrical currents, right, even electrical currents that are delivered via probe in the brain have all shown preliminary work to treat stuttering. Now, we know we need more research here, and that is that these techniques, the direct current, and the magnetic current and the deep brain currents, right? Deep brains are very invasive. It's not something you want to just jump into. Have shown preliminarily some good evidence there, but we need more research. And it really, for many of these, will be like a non-invasive, non-systemic way to treat. And if it's any model like we use for depression and obsessive compulsive disorder, with a magnetic stimulation, you sit in a chair and there's a magnet that changes your brain currents, right? Your brain. that's effective. We use it along with medicines and talk therapy. So there's someone else on the other end here who can maybe talk about that a little more. But what do you know about that, Gonzalo?
I know that we had an experience here in Lisbon that we try, like it was a group of clients with a very low response to speech therapy. And we tried the same protocol that the Oxford study
study with Kate,
but we didn't get the same results. We weren't able to replicate these results.
I'm gonna explain why it's going to be hard. Right now, this is me in a conjecture format. Right, even the TMS, right, it doesn't get deep enough. Right, when we look at this, right, transcranial magnetic stimulation, even with a deep coil, right, this is where it beams the magnetic field low. When we're looking at stuttering, it's on that loop, so you see differences in the cortical area, right? But really, it's deep in the basal ganglia thalamus area that's really functioning as that timer and that switch. So the end effect is at the cortex. But based on the data, I have another article coming out as well too, and Dr. Rama's on here as well too, that I think it doesn't get deep enough. Now we do have 2 case reports in the literature, just 2, one of them was ours, that getting a deep brain probe is effective, right? But that's invasive, right? In other words, you got to drill a hole in the brain and you got to put a probe, in that deep structure to affect it. Now, I really look at science getting at some point to do that, but I also look at less invasive ways where we may be able to penetrate and actually directly affect those deep brain currents that the currents applied on the outside of the brain, just with our technology today, cannot penetrate the brain tissue deep enough to affect in a specific manner those specific tracts that are deep in the brain. That's my theory as to why you weren't able to replicate it and why the TMS stuff is not taken off. It's a great idea. I think Peter Fox's data kind of failed on that. And the bottom line is it doesn't get deep enough. Simple as that.
Yeah. Thank you. Thank you. Charlie, I don't know if you have experience in mindfulness and stuttering. Fatima Dantas is asking us about if mindfulness change anything in the brain, and if we can explain how this work in biological terms. I don't know if you have anything to comment on this question.
Not much. I think I think it has great promise, but I don't have much experience with that, to be honest.
I'm on the same page. I know. Okay, Jerry.
I'm going to go with that one. And Fatima, I have not spoken to you in years, so great to hear from you. All right, so it actually does, because what you're doing there, I believe, is right through the relaxation, the rechanging your mind, right? You're changing the circuits. There's other data looking at meditation, right? And the effects on the brain. We're talking something similar there. So on stuttering, I haven't seen brain imaging. Great idea. Let's put a study together. But I think what you're doing there is you're going to be modifying that cingulate loop. You're modifying that cingulate loop that is going to affect that basal ganglia and really decrease the negative effect on the anxiety and the GABA that comes into that center, allowing your switch of the thalamus and the basal ganglia circuit to work in a much more efficient manner. So there you go. As we look at other therapies where our medicines, the medicines I'm working on now, are going to work in that switch. They're going to work in that basal ganglia. But sure, that's not the whole answer. As we know, just like with OCD, which the SSRIs are working on another switch, the mindfulness, the cognitive behavioral therapy, they're going to be additive to all this. And I also think through the different theories, and there'll be a paper on this coming up soon, right, how the speech therapy, along with the mindfulness and the CBT, would work in a synergistic way. But we need the imaging studies and we need the clinical studies and randomized trials to prove that. We may get that quicker than other things, but I really think we have to show first the effect of the medicine alone, which I'm pretty confident. And then from there, these interdisciplinary therapies will just boom. And I look to all of us to do those studies, and that will change how stuttering is treated and looked at and accepted throughout the world.
Thank you so much. So, it's time for us to finish our panel. I have the last question for you both. What about the future? Like, what is the take-home message about what can we expect about the stuttering therapy in the future? Charlie, what do you think about that?
Well, about stuttering in general, I would say that our number one target should be social stigma.
Okay.
I think we're making progress on this. Progress is slow on stigma, but it's happening. And I think that's really the answer.
That's nice. I'm quite sure we'll have an amazing talk after this with Farah and Pam. We'll work about that and the amazing work they do on that. And you, Jerry, what do you think?
Great. As that next group, Charlie, we're going to achieve that decrease in stigma. We're going to achieve that empowerment through understanding. We're going to achieve that through education. And with that, through the great work of my friend Per and others and Sharir and others, it's the understanding of why we stutter and the acceptance and really the integrative treatment that we're all going to have. So that'll be an acceptance, just like we've seen with OCD, just like we've seen with major depressive disorder. And the biggest challenge that I have is the empowerment that we will do in the National Stuttering Association and others abroad is to allow agencies, funding agencies, to pay for stuttering evaluations and treatment. It's not a parity diagnosis here in the United States. I don't know about other countries, but if people can get treatment for Tourette's, why not stuttering? So that's it. We're going to bring in really the forward in the next 2 or 3 years, right? We're going to have accepted, government-approved biologic therapies. It's going to grow. We are going to work in an interdisciplinary practice. We'll work closely with speech-language pathology as the lead clinicians, bringing this forward with their network referral basis to working with psychology and with psychiatry on really empowering the people of the world, decreasing the stigma, providing hope, empowerment, community. I see bright days ahead. I look forward to this. Thanks to my great colleagues all on this call. As a person who stutters, who's been dedicated to this his whole life, losing a brother to suicide really from stuttering, I'll just share. We have a mission. We have a calling. We will be there. We're there to help decrease the stigma. No one, I'm hopeful, will need to suffer in silence alone like my brother did. That's what this is all about. It's going to take a village. It's going to take a team, and we will be there. So thank you.
Can you? I'm now projecting.
There you go. Hey, what a there you go. All right. Yeah. Well, about 6 weeks ago, right, I had this idea, right, of doing exactly what you did, right, and bringing this forward, and our thoughts about really the revolution. Check out the article in the Atlantic a couple weeks ago, what the stuttering breakthroughs that we have. Read the Frontiers in Neuroscience Journal, everybody. Take a look at that. We are on a change in the stuttering world, right? There's a tipping point now where we're at the understanding of differences with this condition that we've all faced. And our idea now was to bring together the world, sponsored by the National Stuttering Association, on a global research conference to understand where we're going. We're going to bring in the latest in biology, the future of treatments, understanding everything from community and stigma and discrimination and empowerment and hope and advocacy, with the understanding that there are goals, there are treatments, we should not be discriminated. We're just, this is us, this is who we are. But with that acceptance is knowing we are there, we're going to provide hope for those children around the world, that they're going to live as they achieve, and we're going to provide them help along the way. And this is what it's about. The difference of the new treatment model that's coming up and how treatment and acceptance can be one. It's left to everyone as an individual, but we're bringing in medical doctors into this conference to work with the speech language pathologists of the world, the pediatricians of the world, and the community of people who stutter. We want a bottom-up approach to how we develop these treatments and these understandings and these decreases in stigma, and the community of bringing us all together. So that's what this is about. It's just the beginning. We have a bright future ahead. So thanks.
Thank you so much. I love the logo, by the way. Well done.
Yeah.
Thank
That's
you
good,
so
right?
much. Thank you so
Great.
much,
Thank you
Charlie.
so
Thank you,
much.
Thank you very
Gonzalo.
much,
Thank
Jerry.
you.
Thank you.
See
Thank
you
you.
soon.
Say, all right, guys. Take care. Thanks. Bye-bye.
And now I will invite Bernardo to join us, and we will move to the next panel that will be very, very interesting, and to see how we can increase advocacy and awareness about stuttering.
Thanks, Gonzalo.
Thank you.
All right, so hi everyone. Just bringing Pamela. Hi Farah.
Hello.
Just bringing Pam. Here you are. Hi everyone. Very nice to have you here. So let me introduce. Let me see if I can share the screen with our. Well, actually, I don't need to share the screen because I will just briefly introduce our panel and our speakers. So we will talk about changing society's views on stuttering, and I'm very happy to introduce Pamela Mertz. Pamela is the member of the board of directors of the National Stuttering Association, the largest nonprofit dedicated to improve the lives of people who stutter. She's also a diversity and inclusion advocate who believes that talking openly about stuttering is the way to educate the 99% who don't stutter. Actually, we have talked a lot about it today, so it is very important, your role, and I'm very much looking forward to hear what you have to say. So Pamela also hosts the podcast Make Room for Stuttering, which is an almost endless audio archive of conversations about stuttering with 222 episodes since 2009. It's incredible. Greatest pleasure as well to introduce Farah Al-Sabi. Farah launched stutteruae in 2013 to raise awareness and support for people who stutter. In 2016, Farah was featured in a book chapter, well, in this book actually. So Game Changers, How Women in the Arab World Are Changing the Rules and Shaping the Future. In 2018, Farah was awarded the Abu Dhabi Award granted for tremendous impact in the community. And in 2020, Farah launched iStutter Center to provide specialized speech therapy across the MENA region. So very happy to have you here. Strong advocates in the field of stuttering. It's important to spread the word out there to all these people that actually don't know much about what stuttering is, and they should know a bit more. So it is, you have assumed that role in different regions of the globe, and I'm very much looking forward to hear what you have to say, to share your experiences. So my first question goes to Pam. So you mentioned on an interview that you grew up thinking you were the only person who stuttered, which is not an uncommon statement. Mm-hmm. However, today, with widely available access to information, many people who stutter can easily go on the web and look for different data, different information about what stuttering is. So what kind of challenges does today's overwhelming access to information can pose to a person who stutters?
So you're asking what challenges the great amount of information there is available on stuttering on the internet?
Exactly. That it sometimes can be overwhelming. So where to look for the right information? What do you think about it?
Yes. So that is a great question. I think the risk involved in having so much in information at our fingertips is that much of it is unfounded or untrue or not evidence based. So I think there are a number of people who stutter and parents of children who stutter who are desperate to help their child or to help themselves be, be more successful in life, that unfortunately people jump onto unfounded theories about stuttering, and then when they try to implement whatever that suggestion is and it doesn't work, then you have people who stutter who feel like failures. So having that sense of failure indeed exasperates everything else that the person who stutters is feeling as well. And you asked about the sense of isolation. I think much of that is based on what's already been discussed today, but because only 1% or so people in the population stutter, many of us grow up not having ever met another person who stutters. So there's been no role model, and discussion of stuttering was and continues to be so taboo that it's no surprise that people, particularly myself as a young girl and then as a woman who stutters, felt like I was the only one.
Yeah. Sarah, would you like to comment a bit on that, on the challenges that people are facing today, and if you also felt this feeling of isolation in your childhood?
I completely agree with Pam. If it weren't for me growing up with my younger brother who stuttered, I would have felt exactly the same way, because especially in our region, it was something that not only is stigmatized, but it's something that wasn't truly understood. It was always blamed to think that I'm either nervous or anxious or lost of words. But in reality, I wasn't. But with the availability of so many information online, and as Pam said, there's a huge risk of hearing about treatment that doesn't really cure, or claims that they cure stuttering, but it doesn't. It became a way to monetize on other people's discomforts rather than truly wanting to help them. So yeah.
Yeah, good point. There's actually crazy information out there about fixing and healing and curing from one day to the other. It's really so thank you for your views on this. Now to Farah. Well, in the last years you became, if I can put it that way, the face of stuttering advocacy in the Gulf region. And people stutter constantly look for your guidance. Can you tell us what are the most common experiences or stories that people stutter from the region share with you? One or another that you would like to highlight, maybe as an example for others that are listening to us today?
Sure, and I think the examples that I will share are very similar to people who stutter no matter where they are in the world. It might be magnified here because it truly isn't something that we talk about. But for example, there was, and I remember this very, very clearly, a mother came in and just asked us if there's anything we can do for her back then 9-year-old son who stutters. And we were just starting up with Stutter UAE, and I told her what I can do is bring together other people who stutter in the group, adults, and we'll have a conversation, and he'll get to see that people who stutter are not limited because of their stutter. They can choose to understand their stutter and find whatever way works for them and make it happen. And one of the things I remember she was complaining about is her son starting to become very, very aggressive in school because he's constantly bullied And as a reaction, he's becoming aggressive. And that's not something she wants to build within him. So we did that session. And after that, I haven't heard from them in a good 3-4 months. So I sent her a message just checking up. How are you doing? How's your son? Everything okay? She told me that, and for me, that's when I knew that just talking about stuttering plays a huge role in changing the conversation. And especially when we started at a young age. She told me that they had to move back home and all of that, but her son no longer gets aggressive with his classmates that bully him. He's instead asking them to sit down and allowing himself to explain what stuttering is and why he speaks differently than his classmates. So if we're able to get that kind of awareness to the parents, to the kids, and to the school at a young age, we're already starting the wheel of change. And that's what we hope to achieve through Stutter UAE and our partnership at the ICE Stutter Center.
Definitely. Thank you for sharing. Pam, would you like to jump in, sharing one story? You have many, I was going through your podcast, so you have many. Maybe you'd like to highlight one story in particular?
Yes, and I also would just like to emphasize, you mentioned that that the name of my podcast is Make Room for the Stuttering. That's actually my blog, which hosts the podcast Women Who Stutter, Our Stories. And I want to emphasize that because the existence of a podcast that is exclusively for women who stutter, I believe it's the only thing out there that is just for women. So that's significant because, as we know, 4 or 5 people that stutter are male, and only 1 of 5 are women. And it's women who stutter that tend to really be encompassed by that isolation, because not only have we not met somebody else who stutters, but often we've never met another woman. So I would like to highlight just a couple of very brief scenarios on my podcast. So which I've been doing since 2010. So there's 223 episodes, and the women come from all across the United States and 40 different countries. And it always kind of bowls me over that I'm in this position to talk with all of these women. But universally there are themes, there are trends that, you know, women who stutter, whether we're from the United States or from Asia or Africa, that there are things in common. And I think what that is that women who stutter more often than not are the ones that are covert. So we're the ones that try to hide it more, because society conditions us to be the caretakers and to be the nurturers and to manage the family. And we're seen, personally, we see ourselves as therefore inadequate and not capable of doing those things if we can't even pick up the phone and smoothly talk to our child's school about being aggressive at school. But let me just mention 2 quick stories from the podcast. I talked to Christine from the UK in 2010. And Christine was the very first woman that I had ever met that had a stutter so severe that I had the thought in my head, oh my goodness, thank God I don't sound like that. And I was just overwhelmed with this feeling of horror, that how could a person who stutters think that about another person who stutters? And I was so taken aback by that. I met Christine when I visited London. And one of the things I did when I went to London was go to one of the British Stammering Association's support group meetings. So it was there that I met Christine. And during break, I went up to Christine and I apologized to her. And she's like, "What are you apologizing for? We just met." And I said, "Well, I want you to know that when we spoke and we shook hands, and I felt, I immediately expressed in my mind, I'm so glad I don't stutter as bad as you do." And Christine thanked me for that. She thanked me for having the courage to say what I felt needed to be said. And from there, we had a discussion about how very, very, very much difficult stuttering had been for her, and now we're fast friends, and continues to be for her. You know, so like I actually interviewed for her for the podcast, and I remember titling the podcast episode "Facing My Monsters." And to me, that was just very, you know, that resonated with me, and I think a lot of other women. Then in 2000, pardon.
Sorry. We have some people here asking you to indicate the name of the podcast on the feed, on the chat.
Oh.
And also there was this misalignment in my figures between the podcast and the blog, meaning there are two things intertwined, but different things. So go for the second story. Just make it a bit shorter so that we can move on to the next questions, please.
Yes. So,
Thank you.
So the second story, I interviewed Farah in 2014, and what I was so taken with about Farah was that she was interested and did, I believe, begin a support group called Stutter with a Smile. And for me, talking with Farah at that time, it never occurred to me that anybody would equate stuttering and smile together in the same expression, because we who stutter, particularly women who stutter, try so hard to pretend that it's not there and to pretend that we're okay with it not being there. So stuttering with a smile to me was an expression of freedom, because if we're talking and stuttering but smiling, other people take our cues and they react in kind.
Thank you, Pam. We'll talk a bit about that further, because I think you two are great examples of I want to know, how did you achieve that acceptance and how did you get there? Because I know it was not a linear path, and you are very good examples on that, about communicating very well and wanting everyone that stutters to know that it is not only possible, but it is the way to go, is to communicate powerfully and very well. So I have one question now that will begin with a poll. Let me see if I can share. Maybe I have to, I don't know if someone has to give me the permission to share, or if my friends from my stutter are here, if they can share the poll number 5. Wait, let me see. I can do it, I think.
Yes, there we go.
I can. Exactly. So this is the one. I would write the panelists and the host cannot vote, but everyone else can. And can you see the poll? I think the poll is online, right?
Yeah.
You can see it? Yeah.
And
So
while
maybe
we're
ask you to.
Sorry, but while
Sorry?
we're waiting for people, while we wait for people to vote,
Yes.
I just want to share my experience when I found out that I'm gonna be in a panel with Pam after being in her podcast
Sure.
6 years ago. It's incredible how the world works.
It sure is, right? Like it's just amazing how small the world really is.
So true.
Yeah, I remember of seeing that surprise on both of you. Fine. How many years ago was that actually?
That was
when you first
2014.
met?
Yes,
6
yes,
years ago.
yes. That's
And
just
I can
amazing.
clearly see, it's like if I close my eyes, I can see myself as I was taking the podcast, and I was as I was going through the podcast, because it was, I think, my first ever international opportunity to share my journey with stuttering, and that's why it will always be special. So thank you, Pam.
You're welcome.
Right.
and we've come full circle. Mm-hmm. So Bernardo, I just posted the general link to my blog and podcast, and I put the specific link for Christine's episode up on the chat box also.
Perfect. Thank you, Pam. Thank you. So here we have the results, and then we can move on to the next question after going through these results. So I would like, let's maybe start with Farah now. What is, in your view, the biggest societal misperception about stuttering that you'd like to change? And then maybe you can look into the results, see if your choice would be here, and comment a bit on the results.
Sure. I'm just going to read through them again. Mm-hmm. So for me, I think it would be more about, okay. I think it's the one that people who stutter are less intelligent or capable. A lot of times I get people that reach out to me and say that I want to apply for a job or for a major at the university, but I wasn't allowed, or I'm afraid, or and it all goes back to their stutter. And because on the outside, people assume that we're incapable of thinking clearly because of how we talk, they assume that we cannot do the job, or we're not eligible to pursue this major or this career. But if we look at it and see, and this is why, as going back to what Pam said, with stuttering with a smile, it has to start from within. I can't feel self-conscious about my stutter, and if people around me are telling me you're doing great, and if I'm not believing it, it won't matter. So another thing that we did with Stutter UAE is allowing people to see that stuttering isn't something they should be ashamed of. True, not many people would understand it, but the way we look at stuttering, it's our accent. It's part of who we are. It's not all of what we are. Mm-hmm. It's part of who Farah is today. If tomorrow I choose, I no longer want to stutter, then I'll start the path of discovering how I can stutter less. But if I'm looking at it as an accent, and if I'm going to people and telling them, hey, I stutter, but I can do 1, 2, and 3, it will no longer come off as I'm not intelligent or I'm not capable. On the contrary, they'll think, oh, she does speak differently, but it doesn't seem to bother her. So I cannot, as a third person, they can't come and pressure me about my stutter, because I know I stutter and I know it's my accent and I know it's part of who I am. You have to figure out what your problem is with my stutter. It's not me that needs to change. And that sort of understanding that I wish people who stutter can realize. People have power over us when it comes to our stutter because we are still finding our comfort in stuttering.
Well, thank you, Farah. As always, very, very impactful. We have, and I would like Pam to comment on this specific poll, and also on her, maybe if she has one societal misperception that is not here. There is one here, societal misperception, and also mixed a bit with prejudice. Huh? So it's not only societal misperception; it's a bit stronger than that. Let's put it that way. And I have to say that almost all of these questions were inspired on the material, very, very good material that NSA has online. Maybe you recognize them. It was based on those resources that I highly recommend. So we have a very interesting question here, which is very much related with that from Fatima Dantas, which is how can you define acceptance in your own experience? So Pam, I'll leave you with this question and the analysis of the poll, maybe linking it a bit together.
That is such a big question, because I think acceptance for everybody who stutters is completely individual. But for me, acceptance was the solution that I arrived at after many years of having an internal fight with myself about fake Pam versus real Pam. And until I was ready to reconcile those two, and Scott Yaris mentioned this earlier, fragmented, until I was able and willing to reconcile the two fragmented parts of myself that I worked so very hard to keep alive. Once I reached that pivotal moment in my life where I was ready to say goodbye to fake Pam and welcome real Pam, is when acceptance began. And where I was finally able to say to myself and to the world, this is who I am. Take it or leave it. This is what you get every time that I speak and that I share. And I have even begun to say things to myself and even share with others. When somebody says, "Oh my goodness, I've had such a horrible day with stuttering," or "Oh my gosh, I stuttered really badly there," I will reframe that and say, "I stuttered really well. I do stutter well. I have 35 years experience with stuttering. I'm good at it." And I think the other thing is, when we are authentic and we present ourselves, our whole self to the world, we then invite others to do the same with whatever their thing is. And when suddenly you have two people engaged in a relationship, whether it be social, personal, workplace, acceptance happens, because the fear of stuttering and the fear of rejection is replaced with pride almost, and acceptance. And I think we could talk forever. We don't have the time to do that, but we could talk about the medical model of stuttering versus the social model of stuttering, which asks the world to better tolerate and respect stuttering, so that people who stutter do not feel like we have to go to these lengths to appear fluent?
Well, true. It's actually very much of it an individual path, and I know I was listening to you, and I already read lots of things, and I know that journey is really inspiring, but well, full of obstacles along the road. So, and I think like every individual story, it will be, of course. I want to. We had talked about. I had here prepared more questions. I think I'm gonna narrow them down to two more. One of them has to, maybe I'll start also with Sarah here, because it will be helpful to know prior experience on StutterUae, which is I had the chance of contacting with many people that inspired you, and that you helped to really give good information about stuttering, information that they didn't know where to find, and that they were maybe a bit lost, and they could find each other throughout StutterUae. And many years already have passed since the foundation of StutterUae. I want to know if you can give, in a nutshell, what's the secret sauce to create such a strong and lasting community? And if you can maybe measure its impact on the other 99% of people that don't stutter.
That's a tough one. I honestly don't think there's a secret sauce other than a pure intention. And my intention when we started StutterUae was not for me as Farah to get this far. For me, it was I truly wanted to build a community of people who stutter and understand, are they experiencing the same thing I am? Are we feeling the same thing? And honestly, if anything, the secret sauce is the community, their openness, their willingness, and their acceptance of attending any event that's related to stuttering, especially if they're a person who stutters in the UAE or in the region. Because of the stigma that I spoke about in the beginning, a lot of people don't want to admit to themselves that there is, that I speak differently. And with regards to the 99%, I really think that we've come a huge jump from when we started in 2013 and up till now. And it's not just because of StutterUae, it's because of the people in the community that realize the impact on the individual who stutters that they know. And they're like, oh, this works. Okay, let's other people know. And the biggest testimony that I can think of for whether it's myself, StutterUae, or the entire stuttering community in the UAE is me being a recipient of the Abu Dhabi Award in 2018, because this award is not self-nomination. This award is not for people who gloat and show off. This award is a nomination by the community for individuals or initiatives that are doing well or positively impacting their community. And having people from the community nominate StutterUae, and me being able to hear words of encouragement from our leadership is just a huge testimony for what still awaits for the UAE and the region when it comes to stuttering.
Thank you. And Pam, the blog and the podcast and all these people that you have interviewed throughout the last almost 10 years or 10 years now. Also a strong and lasting community that you're sharing with the whole world. Can you tell us a bit more of how did you manage to maintain such a long-lasting project with the same level of enthusiasm and perseverance?
You know, I get asked that question a lot. I started the blog in 2009, Make Room for the Stuttering, because I had a very dear friend of mine comment to me that when he listens to me, he does not hear stuttering. He hears all the words around the stuttering and the words that convey my message. And he said to me, "You beautifully make room for stuttering." So soon after I stopped trying to have real Pam and fake Pam battle each other, I decided that I wanted to begin writing and keep a journal or a diary. And then I thought, well, let me do it online. Let me do it as a blog, because maybe it'll help other people. And then so the blog, and then the podcast, Women Who Stutter, Our Stories. Why have I maintained it for so long? I think at its core that I continue to move forward with this labor of love because it helps me. So it's self-therapy essentially, by me providing a venue and a space for women to share something so deeply personal about themselves. That is manna from heaven for me, and it's as therapeutic to me as I hope it is to them.
Well, thank you, Pam. I have already the other members of the team telling me the time is over. You have to stop. So I had here one more question, and maybe I can stretch for maybe 30 seconds each, and then I will stop. So if you allow me to do that. So Pam, these months of forced house confinement pose several challenges to everyone. To people who stutter, some specific challenges with lots of Zoom meetings or intensive socialization in sometimes very small spaces. Can you tell two advices for people that have to deal with these strange times nowadays? And then I'll have to cut you in 30 seconds.
Yes. So the first I would say, make it a point to talk to at least one person every day. Do not sit home isolated by yourself and not communicate. So that's advice number one. Number two, don't be so hard on yourself. Practice self-compassion.
Thank you, man. Thank you.
Very well done. I think Pam,
can be just one.
Honestly, I think following on to what Pam said about self-compassion, looking into what is it about your stutter, if anything, that you want to change, and allow yourself to go into a journey of self-discovery. That helped me understand my triggers and managing that. And yeah, and as Pam said, just try to at least one person. That's wonderful advice, Pam.
Thank you. And one last thing, I think everybody is struggling wearing a mask. I think wearing masks makes it so much more difficult for anybody to communicate, but particularly we who stutter, it's challenging.
Yeah. Thank you very much, Pam. Thank you very much, Farah. It was really a pleasure to hear you. I hope we can have these discussions more often. I will now pass the floor to Gonçalo, who is really an expert in wrapping up and sending the takeaway messages. So here is Gonçalo. Go ahead.
It was great to hear your talk. So for closure, first saying that Dr. Yaser, we had a technical problem. Unfortunately, he didn't receive our link to join us, and he was waiting and waiting. And for some technical reason, we didn't have his lecture, and we are so sad that wasn't possible. And we hope to have him soon And I also know that some people have some trouble to connect to the webinar. Some people, for some reason, the link didn't work well. And so we will make all these talk available so people can see it after. Probably in these next 2 weeks, we will have it online so everyone can see it. So the message to close, I believe we have a lot to learn. We have some words to take home: acceptance, reducing stigma, evidence-based practice, clinical practice, early intervention, start as soon as possible. So I believe everyone have a role on this, like Jerry was saying, to build this big community, to doing education, and like Charlie said, to respect the neurodiversity, that everyone have something, and we are all different. And like Farah usually say, if you're able to face your stutter as an accent, that everything can be so much easier. So it was really nice to have everyone here with us. I sent my regards to everyone, to be safe, and I hope to see you soon, everyone, face to face. Thanks so much to Farah. Thanks so much to StutterUAE to help iStutter Center to organize this event. And we are expecting in a close future to have more and more events with a lot of interaction and sharing, so we are able to learn with each other. Thank you so much and stay safe. Bye-bye.
Eu queria pôr aqui só uma coisa num instante no chat. Quando a foto é gigante.